Zoonotic diseases originate in animals but can be transmitted back and forth between animals and humans. This possible transfer poses significant risks to veterinary medical professionals, animal care workers, and even the animal's owner. Altogether, there are over 100 diseases that can be transmitted from animals to humans. It's crucial that we have a solid understanding of the most common examples of zoonotic diseases within the veterinary field, how they are transmitted, as well as how we can protect ourselves. Through these understandings, we can identify risks within the workplace and keep ourselves safe to continue caring for animals in need. In the veterinary field, several zoonotic diseases are of particular concern due to their frequency of occurrence and potential impact on both animal and human health. Leptospirosis, which is caused by bacteria of the genus Leptospira, is commonly transmitted through contact with the urine of infected animals. Dogs are particularly susceptible, which is why a vaccine has been created for this to lessen the symptoms if contracted. In humans, leptospirosis can cause flu-like symptoms and, in severe cases, liver and kidney damage. As veterinary professionals, we are at risk through contact with contaminated urine from an infected animal or water or soil that has been contaminated. When collecting or handling urine from a patient, especially dogs, it's vital to utilize all relevant personal protective equipment made available to you. Such PPE may be safety glasses or goggles, exam gloves, and a face mask. If the patient is known to be diagnosed with leptospirosis, additional PPE, including a disposable gown and shoe covers, is recommended. These can prevent transmission through indirect contact. Toxoplasmosis is caused by the parasite Toxoplasma gondii, which can infect a wide range of warm-blooded animals, including livestock and wildlife. However, it's cats that pose the greatest threat of transmission to those within the veterinary field. Toxoplasmosis may present as a fever, swollen glands, and muscle aches in humans, but most people infected with toxoplasmosis have no symptoms. Humans can become infected through ingestion of contaminated food or water, as well as through contact with cat feces. Because cats need their litter boxes scooped and cleaned daily, it's crucial that appropriate PPE is used when handling ill cats. Infection during pregnancy can lead to severe complications for the fetus, so pregnant women should avoid cleaning litter boxes and delegate the task to another when possible. Common PPE that may help reduce the risk of toxoplasmosis transmission are exam gloves, face shields or masks, as well as disposable gowns and shoe covers when handling a known positive patient. Ringworm is likely one of the most misunderstood zoonotic diseases within the veterinary field. Despite its name, ringworm is not caused by a worm, but by fungi known as Microsporum canis. Ringworm can affect various animal species, including rodents, cats, dogs, and livestock. In humans, ringworm commonly forms a rash that is itchy and circular in nature, but with clearer skin in the center. You may notice some hair loss, erythema, or scaling on your skin. Dermatophytosis or ringworm is highly contagious, and humans can contract it through direct contact with an infected animal or contaminated object. Due to this double whammy of transmission routes, not only is PPE extremely important, but ensuring surfaces, equipment, and even clothing don't become fomites is key. Donning appropriate PPE designated by your safety captain can help reduce the chance of contracting or spreading ringworm. Some possible PPE may be exam gloves, disposable gowns, shoe covers, and a face shield or mask. While ringworm cannot be transmitted through the air, face protection may be wise if restraint or handling on a large patient is necessary. This way, even a patient's brief brush against your face will have a lower risk of transmission. Hookworm and roundworm are perhaps the most common examples of intestinal parasites that can be passed from animals to humans. The larval stage of roundworms and hookworms can cause a condition in infected humans called larval migrans. This is where the larvae migrate through various body tissues, causing inflammation. These parasites are often introduced to a human while in the ova, or egg, stage through direct handling of infected animal feces containing eggs. Due to their microscopic disposition, someone can be completely unaware that a surface, object, or other fomite they just touched with their hand, then to their mouth, was contaminated with parasitic eggs. There is no denying that the veterinary field and animal care world is full of poop. Because of this fact, and that we don't always know ahead of time if stool is contaminated, using proper PPE as an added barrier to reduce the risk of transmission against these intestinal parasites is vital. Commonly donned PPE may be exam gloves, a face shield or mask, and even a disposable gown when handling or cleaning small patients. These extra measures can prevent transmission through indirect contact. Last but not least, rabies is likely the first and most frightening zoonotic disease that comes to mind for most people. While this viral disease has been readily lessened throughout the world, it still presents a serious and fatal threat to those working with animals regularly. Rabies is a viral disease that affects the central nervous system in both humans and other mammals. Transmission of this disease occurs through the contamination of an animal's saliva into the bloodstream, most commonly through a bite from an infected animal. Once this contamination has occurred, the disease is fatal if not promptly treated by human medical professionals. The most common signs of rabid animals are changes in behavior, difficulty swallowing, excessive salivation, paralysis, abnormal vocalization, disorientation or agitation, as well as possible hydrophobia or a fear of water. It's important to note that not all rabid animals will exhibit every symptom, and the progression of the disease can vary. Additionally, some infected animals may appear lethargic or uncoordinated rather than aggressive. Use your best judgment regarding PPE when working with, handling, or interacting with an animal whose rabies vaccine status is unknown or is acting in a suspicious manner. Such PPE you may consider using are Hercules gloves, especially with cats, other fluid-proof gloves, safety glasses, and a face shield. While not directly an example of PPE, a catch pole can still be helpful in securing the patient at a safe distance. When reviewing which PPE is appropriate for a possible zoonotic positive animal, it is important to remember that PPE is considered the least effective factor within the hierarchy of controls. It should be understood that PPE should never be relied on alone for safety protection. Regular surveillance, appropriate hygiene measures, and vaccination, where available, are important strategies for preventing zoonotic diseases in both veterinary and human medicine. If you ever suspect that you have been exposed to a zoonotic disease within your workplace, please reach out to your practice manager or safety captain as soon as you're able.